Hello, my name is Nadia Carter, and today I will be presenting on the effect of a low-calorie diet on type 2 diabetes and nutrition. So first, I would just like to start with explaining what diabetes is and what is type 2 diabetes. So first, diabetes is when your blood sugar is too high, and then type 2 diabetes is when your body either resists insulin or it doesn't produce enough insulin to maintain a healthy level of blood sugar level. There is currently no cure to type 2 diabetes, but it's maintained by losing weight, healthy dieting, and exercising. And along with that, some people use insulin to help maintain their blood sugar levels too, if their body will intake the insulin. Making small changes in the way that one eats or exercising can help delay or prevent type 2 diabetes as well. And also a way to help that is knowing your BMI level. If you know your BMI level, it will help you maintain a weight that is healthy for you and help you pick out the correct amount of calories that you should be intaking or the correct that you should be. There are some pretty big health effects to type 2 diabetes, such as heart disease, strokes, kidney disease, eye problems, dental disease. It just goes on and on. And some risk factors of having type 2 diabetes, meaning that you could be at risk for type 2 diabetes too with these risk factors, such as being 45 years or older, as it's typically common in older people and not so much in the younger with type 2 diabetes, or having a family member with type 2 diabetes, as their blood sugar levels could be passed down to you as well. Also having a high blood pressure and a high weight, as most people with type 2 diabetes. And most of the people that tend to be overweight with type 2 diabetes usually do not have an intake of physical activity, and really exercising and having physical activity will help combat that. So for the main thing, a diet is so important in helping type 2 diabetes and helping with the treatment and prevention of it. So a diet positively affects blood glucose levels and contributes to the reduction of insulin taken in the course of drug therapy. Some short-term improvements of a low-carb diet entitle glycemic control, weight loss, and cardiovascular risk, but it's typically not sustained over time. So that's one of the defects of a low-carb diet, is that typically the effects is not sustained over a long period of time with keeping a low-carb diet. Some negative effects of a low-carb diet entitle increased risk of mineral deficiency, hypovitaminous, and reduced intake of dietary fibrous. Also brought a prop. I brought some bread, some Hawaiian rolls, which is also a source of carbohydrates, a huge source. It also creates high levels of protein, which raises the risk of renal dysfunction, along with the increased risk of atherosclerosis appearing in type 2 individuals. In a major change, the ADA in their 2019 position statement now states, research indicates that low carbohydrate eating plans may result in improved glycemia and have the potential to reduce anti-hyperglycemic medications for individuals with type 2 diabetes as well. In whole conclusion though, type 2 diabetes can be maintained with healthy eating. Knowing the different foods that you're intaking in your body and making sure that it's helping maintain blood sugar levels will help to prevent and delay that as well. And a low-carb diet isn't for everyone, but a low-carb diet is one that some type 2 diabetics will use to help maintain healthy levels.